Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas.
As we get through most thyroid stuff that we're going to talk about, the big question everybody has is, is it just low thyroid? All these symptoms that we have, as far as hair issues, weight issues, hormone issues, fatigue issues, sleep issues. I mean, the list goes on and on. Thyroid, we continuously hear that. So the first thing I always like to start out with people is to try to get a good grasp of hypothyroid patients, kind of your story. And majority of people that come through our office have the same exact story with thyroid, where for years and years and years, you kind of gradually get these symptoms. Maybe you start to put on weight. You can't get the weight off. Maybe you start to be, you're fatigued throughout the day or specific times of the day. You can't sleep. You have issues with your skin. Maybe your feet and hands are cold. Maybe your hair starts to fall out. Maybe it's thinning. All these things start to happen. And as you go to your doctor, whether you're a man or a woman, but women typically have these issues first, and at least go to their doctor first. They have these issues and you go to your doctor and you're saying, I have, X, Y, Z symptoms. I've been gaining weight. I don't know what's wrong. I lay in bed for an hour every night. I can't get to sleep. Can't stay asleep through the night. I periodically wake up. I'm eating better than I ever have. I'm exercising. I literally can't get the weight to budge. I feel inflamed. My hair, every time I shower, I'm shampooing. I have hair in my hands. You ask your doctor what is going on, and your doctor usually has the right answer. It says, this sounds like a thyroid problem. Do you have thyroid problems in your family? And most people, they do this. So yeah, my mom had it, or my grandmother had it, aunt has it, so on and so forth. And it's kind of refreshing because you're like, well, good, this might be a thyroid problem that I can catch. And I know there's thyroid medication. So your doctor will run the first test, and it's your TSH, and that's thyroid stimulating hormone. And you'll run that test, you'll come back, and your doctor's going to talk to you and say, hey, TSH came back, it's a little high. It sounds like you have a thyroid problem, at least according to your lab work. And at that point in time, and if you're a thyroid sufferer, this is years ago. At that time, you're like, hey, this is great. I thought something was wrong. I have all these symptoms. I know I'm not feeling like I should. And my doctor found out what was going on. And so you talk to your doctor and they say, hey, now depending on your insurance, we're going to start you on Synthroid, or we're going to start you on Levothyroxine. And you leave and you start to take this. We'll check back in 6 months. So you get on your thyroid medication, and what you're on is thyroid, replacement hormones. Basically what your doctor is saying to you is your thyroid is slow. It's not working as fast as it should be. So now you have all these symptoms. So what we're going to do is we're going to help it along with this medication. And Synthroid is the name brand, Levothyroxine is your generic. And you get put on this medication, and you think that this is going to be the medication that's going to help you out. You think this is going to be the medication that's going to give you back your energy, get the weight down, have you sleeping better, have you feeling better. And the problem is, for the majority of people, that's not the case. You start on, let's say, 40 micrograms of Synthroid or Levothyroxine, and you may notice a little bit of difference, and you say, okay, I mean, maybe this is working. You go back in 6 months, you're still exercising, you're still dieting, and you talk to your doctor. The doctor runs labs again, and your TSH is within normal range now. Your TSH is fine. And what does your doctor say? They say, hey, we got it. We nailed it. We have the correct prescription. We have the correct prescription dosage. Your thyroid is now working properly. You hear those words. Your thyroid's working fine now. And all the patients that we have come through here, just because we obviously specialize in cases, and what I talk to people, and I always, every single webinar I do or any kind of talk I do, it's the forgotten patients. It's those patients that are on medications for years with various different diseases. You don't feel any different, and your doctor says, you're fine, we've got everything under control. So now you're being managed on Synthroid and Levothyroxine. Your TSH is perfect, but here's the kicker. You don't feel any better. And that's the story for the majority of people with thyroid disorders, low thyroid, is you don't feel any better at all. Maybe a little bit for the first year, but you start to have to go back and you start to increase that medication. You continuously go up and down with your TSH. 1 year it's high, 1 year it's low, then you go back and it's normal. And you're playing this game with your doctor where literally the only part of your consultation, or the only consultation you really have, is what's your TSH look like? Is it in normal range so I can switch your medication? After a year or two, it really doesn't matter how you feel anymore. And I think a lot of you know that. You stop asking your doctor or talking to your doctor and mentioning these symptoms because you start to feel like a crazy person. You go in and year 4, year 5 that you're in there, you're like, hey doc, still not sleeping. My stomach's starting to hurt. Why is my cholesterol high now? I've never had cholesterol problems. I've gained 30 pounds over the last 2 years. What's the deal? And I just don't feel good. I have brain fog. My mood is off. I don't know what is going on. And again, whether you're a man or a woman, the more you talk about that to your doctor, the longer you do it, the less you want to do it. Because your doctor's going to look at you and say, well, hey, are you just stressed? Maybe you're stressed. Maybe you have, what's going on outside of work, or what's going on at home? Or maybe, is there anything that you want to talk about? And you start to sound like a crazy person to them. And you start to sound like somebody that's a complainer. And you're that patient that comes in where they look at your chart and they're going, oh, great, here we go, so-and-so again, going to complain to me about their weight, their hair, their everything. And I can't do anything about it because the only treatment I'm going to give them is thyroid replacement hormone. So that's the story. And that's why we have a ton of people, whenever we do thyroid talks, thyroid webinars, we always have a bunch of people emailing us about it saying, here's how I feel. Why isn't my thyroid medication working? Well, the problem is your thyroid medication is not designed to speed back up your thyroid. Your thyroid medication is there simply to replace the hormone that is gone. And as you're going to learn today, in 9 out of 10 cases, this has nothing to do with your thyroid. Nothing to do with your thyroid. So what is the real issue? So when we get into the thyroid, here's the first thing we have to get into, and that is, what does the thyroid actually do? Because as you can see through that entire story I just told you, there is no thyroid education coming from your primary care physician or your endocrinologist. There is no, hey, here's what T4 means on your lab test. Here's what T3 means on your lab test, if they're even running it, by the way, which we'll get into here in a little bit. What does TSH mean? What does TSH do? Why do I have to have it within normal lab range? Why is it bad if it's high? There's no education because you have that 8 minutes with your doc to really nail down what their treatment plan to manage your thyroid disorder, and that's it. So let's get into actually what the thyroid does here, okay? So I've got a slide up. Obviously, we're doing this through Zoom onto a TV screen, so it might be hard to see some of this stuff, but real easy, here's what we're gonna do as far as T4, T3, explain how that is made. So up here in the brain, TSH from your brain tells your thyroid gland to make thyroid hormone. So TSH from the pituitary gland up into the brain here, that's going to send something out called thyroid stimulating hormone. All right. And that is a hormone in what many cases will be called a prohormone because it tells your body to release more hormones. That floats down to your thyroid right here, that little butterfly shaped gland right in your neck. And TSH will stimulate that thyroid to release T4. Okay. So you can think of TSH as kind of like the gas pedal, and the car would be your thyroid. If you're pushing down the gas pedal, sending more gas to the car goes faster. Same thing with the TSH. If you're sending more TSH to the thyroid, you're speeding it up. So if you see the TSH high on your lab work, that means your thyroid or your body's trying to speed your thyroid up. If you see the TSH low, it's like you're pulling back on that accelerator, the gas pedal. You're trying to slow down your car. So if you have a low TSH, that means you're trying to slow the thyroid down. So now we have the thyroid doing its job, which is releasing T4. And you'll see it on your lab test as total T4. And about 90% of that release is T4. And then you have a little bit, 10%, 7% sometimes, of what's called T3, the other thyroid hormone. So you have 2 major thyroid hormones, T4 and T3. So the thyroid gland comes down, it will push out T4, and T4 really doesn't do hardly anything in the body, all right? So that's the first big thing I want everybody to know, because your primary care physician, every time you come in, if you're already diagnosed with a thyroid disorder, is only going to check your TSH and your T4. And then if you're a long-time thyroid patient, all they're going to check is just your TSH, because they're just looking to make sure that prescription medication is normalized. So T4 goes out. T4's job is to go to the liver and the gut, where it is then converted into T3, the other thyroid hormone. Now T3 then goes out to the rest of the body and does every single thing the thyroid does. It controls everything. That's how the thyroid controls many of the processes in your body. So T4 really, if we're looking at the lab test and TSH, that's not the whole story, clearly. We need to know what your T3 looks like. And if T3 is low, you will have thyroid symptoms. So that is what you have to look out for. And as you can see here, if we're converting T4 from the thyroid into T3 in the liver and the GI tract, well, what if something's wrong with the liver and the GI tract? Maybe that will give you thyroid problems, and we'll get into that here later on. So there's a lot more to the story than just push prescription meds in. And if you're guessing, you're asking yourself, what is Synthroid and Levothyroxine? Synthroid and Levothyroxine are synthetic T4, okay? So the question then becomes, well, if T3 is what does the job, why am I not getting T3? Why am I only getting T4? Your doctor and the pharmaceutical companies that make Synthroid and Levothyroxine, they're counting on that when they give you T4 in the form of Synthroid and Levothyroxine, that your body can convert it into T3 and then utilize it. So there's a lot more that goes into this, and that's one of the reasons, and probably the main reason, why even when you're on Synthroid and Levothyroxine, you don't feel any different for the majority of people. Now, I'm not saying that, you know, some people I've definitely met have gone on it, feel great, but if you have issues in the rest of your body where you cannot convert T4 to T3, then there's going to be a problem. And that's the majority of thyroid sufferers. You guys are not converting T4 to T3. So one of the primary reasons you have hypothyroidism, it's called underconversion. And there's a majority of thyroid sufferers, 9 out of 10 probably, are called underconverters. So the T4 goes in, maybe you're on 80 micrograms of T4, but your body can only convert 20 micrograms of it or 40 micrograms of it. So your T3 is still low. And the worst part about this is, as we know, you go to your doctor, do you ever get your T3 checked every time you do lab tests? Nope, you don't. Never, almost. Maybe if you have a progressive doctor right off the bat, they'll check your T3. But that's the biggest issue. So let's now look, once T3 goes out, what does it control and what can trigger issues with T3 conversion? So here's all the problems that can occur that can make that Synthroid or Levothyroxine not work or make your T4 not work. So we have toxins, endocrine disrupting chemicals such as BPA, the things that can be in bottles and cans and different plastics, can actually prevent you from converting your T4 to T3. Pregnancy and menopause, this is a story I hear all the time where hypothyroidism is triggered, where you'll say, after my first kid, I have no idea what happened, but my health went downhill. I gained all this weight. I don't feel good. I don't feel any better. And all of a sudden, I have thyroid problems. So that's a trigger, and we're going to get into why that is. Medications. You have certain medications here that will interfere with thyroid hormone production. We're going to show those here in a second. And the worst part about this is many of these medications are the ones that they put you on after you have hypothyroidism. Reduced absorption of thyroid hormone replacement. So certain medications, and we have PPIs here would be listed number one. So your omeprazoles and those types of things, they can stop thyroid hormone absorption. So once you get on them, you're not absorbing your thyroid hormone anymore. Supplements, iron and calcium interfere with thyroid hormone absorption, and coffee reduces the intestinal absorption of thyroid hormone. Coffee. How many of you, because you're fatigued from thyroid issues, even while on medication, drink 1, 2, 3 cups of coffee a day? That's a problem. We have over here stress and inflammation. That's a biggie. We'll get into that. Nutrient insufficiency, and this is one that where we come in, we can start to help everybody out. And we'll talk about the specific minerals, selenium, zinc, iodine, those types. Autoimmune conditions can trigger it, and then congenital or pituitary disorders. So what does the thyroid do? What are some common low thyroid symptoms? Fatigue, weight gain, inability to lose weight, hair loss, brittle hair, loss of the outer third of your eyebrows, depression, constipation is one of the biggest ones. Ladies especially, I know I have a couple of guys in here. Guys, for whatever reason, know that a daily bowel movement is normal. Women, I don't know what it is. Every female patient I have, I'll ask how often you're having a bowel movement. You'll say, one every 3 days. And you think it's normal. You have to have a bowel movement every single day. If you are not, there is an issue. We have poor circulation. That's why you get cold hands, cold feet, sensitive to cold weather. Muscle cramping is a big one. Weak immune response, cholesterol problems, and anxiety and mood. Cholesterol is a big one. If you notice that once you have hypothyroidism, all of a sudden you have a cholesterol problem, and then you get put on a statin. So if you can get your thyroid under control, chances are your cholesterol will then be normalized. Excuse me. Thyroid and human physiology. So now we know the symptoms here, how the thyroid impacts all of these. It controls brain function with neurotransmitters, red blood cell metabolism, making your red blood cells, so it controls whether or not you're anemic, liver function, gallbladder function, cholesterol metabolism, GI tract function, hormone production, estrogen, testosterone, cortisol, bone health, bone density. That's why women later in life struggle with bone density issues when you have hypothyroidism, cardiovascular system, blood sugar metabolism. Ask me how many of my hypothyroid patients also have blood sugar problems, probably 9 out of 10, and protein metabolism, so digestive issues. So this is a lot. The thyroid is a gland that controls many things, and that's why it is so important for you to figure out a way to get this thing working and not just suffer on Synthroid and Levothyroxine the rest of your life. So with GI function, low thyroid states reduce the transit time of matter through the intestinal tract. That's why you get constipated. You inhibit absorption. So low thyroid and constipation, that's why I always harp on make sure you're going to the bathroom daily, because if that, two things will happen. If you are not going to the bathroom daily, that bowel movement or the feces, the stool that's stuck in your intestine, it just sits in there. So two things are going to happen. Number one, your colon is constantly absorbing and reabsorbing things that are inside of it. So if you break down foods and you're pushing out waste products that sit there, you then start to reabsorb the waste products and you basically pull back in toxins. All right, so you have to make sure that you're expelling. The reason you have bowel movements, half the reason is to expel toxins out of your body. So tip that has nothing to do with thyroid, migraines and headaches, if you chronically have those, see how often you're having a bowel movement. The majority of people that have headaches and migraines are constipated and you're reabsorbing toxins that cause headaches. The other thing is that now you are breaking down that intestinal wall and damaging it. You're not going to absorb nutrients because those bowels are too slow. You're stalling the process. So essentially, if you have hypothyroidism, chances are you are going to be malnourished. You'll have nutrient deficiencies. All right? Dysbiosis often exists in low thyroid states. What dysbiosis means is basically gut bacteria, yeast, organisms inside your body that are going to cause issues with inflammation, hormone disruption, immune system function is a big time one. So you want to make sure that GI tract is moving. Low thyroid and weight gain, this is the biggest one. Even when you get on Synthroid and Levothyroxine, I can't lose weight. In fact, I'm gaining weight. Everything I do, I go for a 2-mile run. I can't even budge a pound. And after my 2-mile run, I weigh myself in the morning and I'm heavier. So what is going on with that? The role in regulating metabolic activity. So your thyroid is what is actually called, and it's termed, the gatekeeper to metabolism. The faster your thyroid is, the more your metabolism goes, the more energy your cells can burn. The slower your thyroid is, the slower your metabolism is. And so you'll start to gain fat because your body's storing energy rather than burning it. That's why when you have two people, when you compare, if you have hyperthyroidism, they're always skinny, really skinny people. If you have hypothyroidism, chances are you're heavier, okay? We create fatigue. If you're fatigued with hypothyroidism, you obviously don't want to do any activity. And then we impact growth hormone and insulin growth factor. So you can't even build muscle. You can't even burn sugar. You're going to store it. We have low thyroid and neurotransmitters. So here's the things we always see: anxiety, depression. We have issues with mood as far as mood swings, irritability, and then the memory and the brain fog. Brain fog is a big one with thyroid. I can't recall things. I can't I'm trying to talk to this person. I know I met them a week ago. I can't remember their name. And all these things occur because of the neurotransmitter functions with thyroid. So especially the epinephrine and norepinephrine coming from the adrenals, the thyroid is really involved with that. The higher your norepinephrine and epinephrine are coming from your adrenals, the more irritable, more anxious you are. And so you've got to get those down, and that's what occurs in low thyroid states. So we have, moving on, one of the big ones that most people don't even know is going to be a part of hypothyroidism, and that is reflux and heartburn, gastric issues. And all of you in here, if you have hypothyroidism or suspect you have hypothyroidism, I can guarantee that around that time that these other symptoms started, you started to have more heartburn with certain foods. You had gastric reflux even maybe, or you had a stomach that just doesn't feel good sometimes after you eat. And your doctor hears those symptoms, and what do they say? Oh, you have heartburn. No problem. Let's put you on omeprazole, and that's going to stop your stomach from producing acid. Okay? So as we see here, low thyroid states are usually accompanied with low gastrin levels. Gastrin is going to come from your stomach. Gastrin is important for proper gastric function, and it means that it helps you produce stomach acid. So the problem with reflux, and I've done a video on this, if you haven't gone to our Instagram yet, go to @FHCCarolinas, @FHCCarolinas. Check out our stomach acid video. Most of the time, reflux and heartburn is low stomach acid. You're not producing enough. And so then you have intestinal distension and different things that go on with pressure. That sphincter at the top of your stomach does not close, stays open. So then when you do eat and you do try to secrete acid into the stomach, it spills up, and that's the heartburn. So that what will then occur is that you get on omeprazole, which makes it even worse, and now you're caught in this cycle. And the funny thing is about omeprazole, and if you guys are on omeprazole yourselves, how long do they tell you to take it? 8 weeks. They say take this for 8 weeks to see if it helps, and then we're going to stop it. You don't want to take it longer than 8 weeks. And how many of you have been on omeprazole longer than 8 weeks? Probably a lot of you, okay? So this is an issue with the thyroid. It has nothing to do with your actual stomach. You have to get the thyroid figured out for this to help itself. If you don't, then you can't break down protein. You have issues with bone density because you need calcium absorption with stomach acid. You have all these issues occur. So we've kind of gone through what the thyroid does. For most of my thyroid people, or people that don't know in here that they have thyroid disorders, or a thyroid disorder or hypothyroidism, you'll eventually end up on these various medications, or if you do have hypothyroidism, these are the medications that you usually end up on, or a variation of them. So from top to bottom, you have your Synthroid or your Levothyroxine, then you're on your cholesterol medication, eventually a statin drug, Crestor, maybe Lipitor. Then you get on your antidepressants, and they're saying, okay, well, antidepressant, anti-anxiety medications, hey, you know, this sounds like it might be in your head. Maybe you're stressed. They get you on Lexapro because you're complaining all the time about your stress, and it's actually your thyroid. High blood pressure medications, you get on your lisinopril and those types of things eventually. You have your sleeping pills because we can't sleep. Oh, you can't sleep at night? And you've talked to me about this all the time. Let's try Ambien finally. Maybe we'll try Ambien. Then you're on your acid reducer, omeprazole, and it's because once you start to have these thyroid issues, as we know how many things the thyroid controls, your doctor, and how conventional medicine is these days, especially in the United States, is whatever you complain about, they're going to give you a medication for. They're never going to look at all these things and go, well, gosh, Susie Johnson has high cholesterol, gastric reflux, she's having bone density issues, she has anxiety, she can't fall asleep. Maybe that's her thyroid. Okay, well, I know I already have her on thyroid medication, so I've done my job. Let me give her medications for all 5 of those things, or all 4 of those things. That's it. And that's what your consultation is going to be like the rest of your life. You get a medication every single time, every time you complain about something, instead of looking and seeing what 1 or 2 things can we fix that will fix all of these. And so they should know, as your doctor, if you're on Synthroid and you still have all this crap going on, clearly that's not working. And it's never like that. So how can we help this? We have to make sure that we get off these meds somehow, okay? Because this slide is going to show us what is actually occurring. And we talked about this on a previous slide about medications, what they do to thyroid absorption. So here's your medications. You have your anti-inflammatories that you possibly could take, ibuprofen, those types of things, antibiotics that you may take from time to time if you have infections or anything like that. UTIs. You're on your antidepressant now, possibly. Diabetic medications. A lot of thyroid sufferers will get on metformin eventually. You have hypertensive medicines, so your blood pressure medicines, pain medications, antacids like your omeprazole, and your cholesterol lowering medications, your statins. So let's say you get on all of those because you have a hypothyroid issue. Well, they actually don't change your TSH at all. Your TSH stays the same regardless. But what they do is this. They alter thyroid hormone secretion, so they actually slow your thyroid down. They decrease your absorption of your thyroid hormones. So now if you're on one or multiple of those, even if you're getting Synthroid, you're not absorbing it properly. They alter thyroid binding globulin hormones. That's a hormone that converts your T4 to T3. They alter thyroid hormone clearance, how well it can get secreted out to the body. They alter TSH responsiveness. So even if your thyroid slows down, the TSH doesn't get released as much as it could be. Alter thyroid receptor responsiveness, meaning the receptors for your thyroid hormones have to be available and ready to catch that T3 when it goes out and tells your brain to function, your heart to function, your muscles to function. Dysregulates the hypoparathyroid feedback loop and decreases T4 to T3 production. So if you get on all these, which chances are you're going to eventually at some point when you have hypothyroidism, your doctor, again, is just running your TSH. They don't change the way your TSH looks, but they sure as hell change everything that's going on with your thyroid. And that's why once you start going on this, flowchart healthcare of just complaint medication, your thyroid medication, A, will start to work less and your thyroid starts to work less. And that's why you will never feel better even when you go on all these. So this is the problem with the current treatment model of thyroid or hypothyroidism. Okay, labs, we've talked about them a little bit. We need to get straight what your labs should actually look like to be optimum. Not what LabCorp says Thyroid Labs should be, what your optimum thyroid labs should look like. And that's why there is a ton of people that have what's called subclinical hypothyroidism, where you have hypothyroidism that is just on the end of the lab range. You're not out of the lab range, but you're just on the edge of it. And your doctor says, well, you're low normal, but we're not going to do anything until it gets too low or until it gets low. And you're going and saying, well, doc, I have literally every single hypothyroid issue, and you're going to wait till my labs look bad enough to do something. And that's the case. They will wait until things are so bad that then they will finally do something for you. And you ask yourself, why is that? Why would my doctor wait until my labs look off before I actually do something? Well, it's because it's insurance. That insurance that's covering your medication, covering your treatment, they're not going to do anything or pay for anything until that lab says, yep, they actually do have hypothyroidism. So that's a big difference. Whereas functional medicine, what we do, I'm looking for patterns. If you're low normal, clearly there's an issue. We have to get you back to optimum. So let's look through these. So we have typical lab range of TSH. The typical lab range you're going to see, LabCorp, Quest, 0.45 to 4.5 for your TSH, okay? That's huge. 0.45 to 4.5, I mean, obviously just knowing the anatomy that we've already gone over, if your TSH is a 4, you're probably speeding things up a lot faster than somebody at a 0.46, right? So the optimum lab range, and this is from the American Endocrine Society, they've developed optimum lab ranges. The optimum lab range for your TSH is actually 1.8 to 3. And you will see a lot of times where if you're over 3 with your TSH, you will have thyroid issues and you'll have thyroid symptoms. If I have a patient that's a 3.3, 4, 5, I'll start to work on their thyroid in general, and obviously we have to look at root causes, but that's telling me it's slightly slow. Now this bottom number, I will say that one's a little bit flexible. I'll see people at 1, 1.2 that feel fine and we won't address it. But over 3, there's something going on. So that's your optimum thyroid stimulating hormone. We have typical lab range of total T4. So that's your T4, the first thyroid hormone that's released. And so your lab's gonna say, yeah, 4.5 to 12, that's where we're at. And obviously, if we know hypothyroid, you want enough T4 because you got to turn T4 into T3. Well, the actual optimum lab range is 6 to 12. It has to be above 6. You want to see that above 6. If it's above 6, you're doing great. You're releasing enough T4, or your Synthroid or Levothyroxine is being dosed correctly. We've got typical lab range of total T3. This is where we start to look for the actual patterns with your lab work. So if you are somebody that still has thyroid symptoms, look at the total T3. LabCorp says 71 to 180. The functional lab range is 100 to 180. Get over 100. That will give you the best shot of feeling as good as you possibly can. But the end-all be-all T3 is going to be your free T3, okay? So the typical lab range of your free T3, and what free T3 is, the bioactive form of T3. So your T3 will go out in the body, and your body manipulates it so it's the bioactive form, basically turns it on so that it can go out and do the things it needs to do for the thyroid. This is what you want to see, and you need to ask your doctor all the time to run this. Say, doc, I want to see my free T3. I still don't feel good. What does my free T3 look like? So the lab range you're going to show you is 2 to 4.4. The lab range you want to be at is 3.5 to 4.4. 3.5. Majority of women especially, majority of women, but majority of hypothyroid people, if you aren't over 3.5, then you will have symptoms still, usually. So get over that 3.5. And this will actually help your doctor maybe even dose your Synthroid. Because you've got, even if your T4 is normal, you can still have low T3. That's the issue. You can have normal TSH, normal T4. If they're not running your T3, you don't have the whole story. So if you're a converter or you're an underconverter, that T4 could be a 6, your TSH could be a 2.5, but your T3, and especially your free T3, could be a 2.2. And no wonder you don't feel as good as you should. You've got to get this higher. And there's a great book out there by an author, and I did a podcast with her, Elle Russ, Paleo Thyroid Solution. Look this book up, The Paleo Thyroid Solution. She talks about on her journey with her thyroid disorder that she actually feels better over the lab range, even over 4.4. So if you can start to help that T3 get even higher, basically what we're saying is, and even what she says in this book is, don't go off lab ranges sometimes. You know, work with your doctor and say, where can I get my body to feel the best? I don't care if it says 4.5 on my lab, that's where I feel the best. It's not what the lab does. A lab is a piece of paper, okay? Even if it says you're normal and you don't feel normal, then that doesn't mean you're fixed. You have to get the symptoms corrected, all right? So here we compare the typical thyroid labs, and they're probably hard for you guys to see on Zoom, but I always compare this because this is a functional medicine thyroid panel that we will do. This is every single thing that we will check. We've got your TSH, your T4, your T3 uptake, your free thyroxine index, total T3, we have your free T3, we have your reverse T3, your free T4, then we have thyroid peroxidase antibodies and thyroglobulin antibody. And that is a full panel. I will usually continuously test that if you have a major thyroid problem. We have to see everything. Here is your primary care physician thyroid panel, and I'm being very generous with this. This is TSH, T4, T3 uptake, and free thyroxine index. In general, though, it's just TSH and T4 every time you come in. And again, that's insurance-based care. Your insurance carrier is literally going to say, I don't want their thyroid tested more than once a year, and they just check your TSH. So let's look at the difference. TSH, T4, and T3 uptake, let's just say that. Here they are at the very top, okay? These first three. Now, if you're looking at this, you're going, wow, this is a very big panel. And at the bottom, we have two that say abnormally high. Well, so if these are two of the same patient, you're going to miss this when it is ran, aren't you? And that's why you still probably feel the way you do, even though your doctor is so-called running a thyroid panel on you or running a thyroid test. We can see with this person, their reverse T3 is high, and they have an abnormally high thyroid peroxidase antibody. Reverse T3. When your body makes T3, it makes about 80% T3 and 20% what's called reverse T3. Reverse T3 does nothing, okay? So your body kind of does that as a defense, not necessarily a defense mechanism, but as a mechanism so that it doesn't create too much T3 and make you or put you into a hyperthyroid state. So it does this and cranks out reverse T3 due to this big influx of T3. So if you have high reverse T3, you're making too much of that. And that means you might be making not enough actual T3. Things that will cause reverse T3 to go up would be inflammation, estrogen issues, gut issues. And so this patient we're looking at, they may come in and say, I still have thyroid symptoms. And they're looking at it and they'll bring me this and they say, well, my doctor says it's fine and I don't have any red flags on here. But we look at this and say, well, that's interesting because I think I know why you have symptoms. Your reverse T3 is high, meaning that the T3 that's being produced, is majority of it is reverse T3, and you're not getting enough T3 in your body, and you're probably either inflamed, have estrogen issues, or have gut issues. We're going to touch on thyroid peroxidase here in a second, but this is the difference. This is why you have to have the whole story with your lab tests, okay? So that thyroid peroxidase antibody and thyroid globulin antibody we saw is one of the biggest things we're going to talk about in this presentation, what 9 out of 10 thyroid sufferers have, and it is Hashimoto's thyroiditis. So we see the word thyroiditis, inflammation, or basically inflammation of the thyroid. And then Hashimoto's is a person that discovered this, I believe, or where it was, I can't remember. But thyroiditis meaning that you now have an autoimmune disease that's after your thyroid, okay? Excuse me. And this is what 9 out of 10 thyroid sufferers have, okay? Now, that statistic is based off of clinical research and essentially assuming who has it, because your doctor rarely, if ever, will test for this. So these antibodies come standard in our lab tests, because this can make or break which direction we go with your thyroid treatment. So if you look at this person is an actual patient we have. Thyroid globulin antibody is down here. And this is a 0 to 0.9 lab range. And this person registered at a 2,250. She might actually be in this talk right now. I think I saw her name. But it is very big on a lab scale. And so what we're looking at here is an antibody measure, which is an immune cell used to mark foreign objects for attack by the immune system. So if your body feels threatened, it will send an antibody out to attack. And thyroglobulin and thyroid peroxidase, we know, are 2 enzymes that turn your T4 into your T3. So these are your converting enzymes, okay? And like we talked about, as we know from our physiology now, we've done this little thyroid diagram in the very beginning. T3 is what does the job, and T4 from Synthroid, Levothyroxine, or your thyroid have to be converted into T3. Well, if you have an antibody attack towards these 2 enzymes, that means your immune system is going out there and destroying them. Same thing with rheumatoid arthritis, with psoriasis, with type 1 diabetes, MS, scleroderma, lupus, all of these autoimmune disorders that we know about. Your body is accidentally attacking a specific tissue in the body. So type 1 diabetes, your immune system attacks the pancreas. Rheumatoid arthritis, your body attacks the joints. Psoriasis, it attacks the skin. Same thing with Hashimoto's thyroiditis, your body's attacking the thyroid. So imagine this, if you have T4 released from your thyroid, it goes out and you have Hashimoto's, and your Hashimoto's is destroying the very enzymes that will take that T4 and turn it into T3, are you going to be able to make T3? No. So this is the disease. It will make you have a quote unquote low thyroid because according to your labs, your thyroid hormones are low. When in reality, it's not your thyroid, it's the immune system that is the problem. And so this is a big difference between hypothyroidism and Hashimoto's thyroiditis. Be clear, if you do not know if you have Hashimoto's, test, because it could make a huge difference on how you will be able to go about making yourself feel better with your thyroid. So traditional hypothyroid is the thyroid literally is just not making hormone. Hashimoto's, your thyroid's working fine, and it can't convert the T4 to T3. Okay, 9 out of 10 thyroid sufferers have this, and not just hypothyroidism. Okay, and you just look for these two antibodies. If they're positive, one or the other or both, you have it. This runs in families. So that's why when you say, yeah, my mom had hypothyroidism, my grandmother had it, my aunt, women especially, this runs through families. The other thing that will happen is autoimmune diseases run through families. So you could have grandmother had type 1 diabetes, mother has rheumatoid arthritis, you have Hashimoto's, your daughter has psoriasis, or a combination. Okay, so you all carry an autoimmune genetic trait, and it will basically exhibit itself in various different types of autoimmune diseases. What you'll also know is if you have autoimmune disease, you typically have several. And this is what patients will come in and say, yeah, I have a thyroid disorder and I have celiac, or I have thyroid disorder and I already know I have rheumatoid arthritis. So these things will play off each other. The problem with Hashimoto's is it typically leads to other autoimmune diseases. If you have Hashimoto's, a lot of people later in life or as they progress through the disease will develop most usually lupus, type 1 diabetes, rheumatoid. So you want to make sure you get these antibodies under control. The goal of this treatment is to lower the antibodies as much as you can. If you can get them lowered and very low, then that means you're not attacking the thyroid, you're not attacking these enzymes, and your thyroid can function properly. That's the goal of the treatment. Now, the one interesting thing is there are some doctors that will test for this, and maybe there's some people in here that are actually saying, yeah, I already know I have Hashimoto's disease. And I would ask, if we were at a talk, which I wish we were at a dinner talk right now, I could talk to you guys. If you already know you have Hashimoto's, I would ask you, what is your thyroid treatment from your conventional doctor? And you'd say, Synthroid. That's the problem. Even if your doctor knows you have this, they don't change the treatment. The treatment will not change whatsoever. They will look at this and say, yeah, you have an autoimmune disorder, and that's it. They will try, and what they're counting on is they're crossing their fingers hoping that they've got your dosage of levothyroxine and Synthroid good enough to where if they flood you with enough T4, even though some of it's getting destroyed, some of it that's left over will get turned into T3. And that's no way to treat somebody. So you've got to figure out how to take care of this a different way. There's no medication for this. Just like there's no medication for rheumatoid arthritis or type 1 diabetes or anything else. What do we do with all those disorders? We try to slow the immune system down as much as we can. When you're a rheumatoid arthritis patient, you're on what? Prednisone, methotrexate. That's just slowing the immune system down. So it's the same thing with this. We just have to lower this down. So autoimmune disease, here is the actual definition. When the body's immune system confuses normal tissue as a threat, sending antibodies to that region of the body, attacking and not stopping until the cells and tissues are destroyed. Similar to your immune system attacking a flu virus or a strep bacteria, autoimmune diseases have areas of the body such as the pancreas, skin, joints, and thyroid, to name a few, that are under attack. Okay, so like I said, majority of people have this that have hypothyroidism. You need to get this checked. That will change your life dramatically once you know that. If you think you have it, here's something you can look out for. The people that typically have Hashimoto's disease, one big thing that always pops out is your TSH, and I know a couple of hospitals systems will do this. They'll track your lab data. If your TSH graph is like this over the years, you probably have Hashimoto's. What they call it is a roller coaster TSH, where every 6 months or every year, every 3 months, even if your doc does this, it's up, down, up, down, up, down, up, down, up, down. And then sometimes your medication will follow this, where it's, 1 year I'm at 50 micrograms, next year I'm at 75, next year I'm at 100, next year I'm at 125. Then we went back down to 100, then we went back down to 75. Those are telltale signs that you have Hashimoto's, because what's happening is when your body gets inflamed or stressed or things are going on, your body's going to produce more antibodies. Okay, so think about this. When you're sick, don't you feel more inflamed? You're more stressed, you feel more inflamed. Your stress will push the immune system to send out antibodies, and you will actually go after the thyroid a little bit more at that time which will slow it down. So one thing I want to tell everybody as well is if you know you have this, or if you don't know, you try to figure it out, because it's going after the thyroid. And so if you have those goiters, or if you have the lumps on your thyroid and you're feeling, or your thyroid's enlarged, those types of things, that's autoimmune. Your body is attacking that thyroid. So chances are you have these antibodies going up there and eroding the tissue. If you don't do anything about this, and it goes on and on and on, eventually you're going to need that thyroid either taken out, a lobe taken out, or you're going to have an issue where you flip and go hyperthyroid, or vice versa. Okay, so what pushes Hashimoto's an immune attack with the thyroid? Assuming that 9 out of 10 people have this, assuming that 9 out of 10 people in this specific Zoom webinar have this, what causes you to release antibodies? We have estrogen and hormone surges. We have insulin and blood sugar surges. Liver and detox problems will trigger an immune attack. Gut problems will trigger an immune attack. And adrenal issues or a stressful event will trigger an immune system attack. So let's get into the liver. If you've ever seen one of my talks before, probably some of the same stuff here talking about the liver, but it regulates hormones, makes your thyroid conversion possible, and it detoxifies the entire body. So that T4, remember, comes down into the liver. Oops, trying to do the weatherman thing here. Comes down to the liver here, turns T4 into T3. So that's why the liver is very important. We have 2 research studies here that I pop up. Clinical associations between thyroid and liver diseases. People that have ever been told you have fatty liver, you might have had that trigger your thyroid disorder. So in order for your thyroid to function properly, or even if you're on Synthroid and you just want to feel better, or Levothyroxine, you've got to make sure that liver is working properly. And those liver tests are going to be something that you need to look out for as far as patterns. Not waiting again until this liver lab work looks terrible or bad enough to do something about. Thyroid hormones in relation to lead, mercury, and cadmium exposure in the National Health and Nutrition Examination Survey. So this one went into how toxicity issues, especially with heavy metals, but it goes into just overall toxins, cause your thyroid to slow down because the liver cannot do its job. So again, we compare these, and we typically talk about, again, primary care physician liver panel, which is your basic metabolic panel. Anytime we run a liver panel, we want to see your functional medicine liver panel, because you're going to have additional enzymes in here. And as we can see, alkaline phosphatase, bilirubin, ALT, and GGT here are high on this person. We have LDH, which is something that's not going to be over here, but the big ones you don't see on this primary care physician are your LDH and your GGT. They're very important. I tell this story all the time. This patient on the right side had a liver problem, came to me, but he was there for diabetes. He said his liver panel looked fine. He gave me his primary care physician liver panel. Everything did look okay, but it wasn't the whole thing. It's like he still has liver issues. Why would we not want to run an entire metabolic panel? Well, he was on Medicare. Medicare didn't want to do it. So I said, okay, let's just run a cash test. This test is $17, the whole thing. Let's run that and just take a look. Sure enough, his GGT here is 639. 10 to 60 is the normal range. Well, sirens, there is a major problem, clearly. He had pancreatic cancer that would have been missed had he not run a comprehensive metabolic panel. So there you go again, the difference between primary care physician or specialist insurance-based care, not looking at your symptoms. You've got to run all these things. So for us, let's say you're a thyroid patient, you need to see these extra enzymes in here, because your doctor may say everything's borderline here, but what if these pop up and they're high? You're not converting your T4 to your T3. You will continue to have thyroid symptoms. Heavy metals, like we just discussed in that clinical study that I posted up, toxins, cadmium, your mercury especially, we can get that from fish and shellfish. If you have heavy metal problems, you will have trouble converting your T4 to your T3. Your doctor will say your TSH looks fine. You'll continue to have symptoms. One of our patients here, arsenic, major arsenic issue, 99.9 percentile on this test. This is a heavy metals test. And she had thyroid issues. We clear out the arsenic out of her body. She started to feel 10 times better. almost drastic, like overnight. It was about maybe 2 or 3 weeks time where it was a major difference once we started to take the metals out of her body. So this, again, is a great example of where the doctor was just watching her saying, we're just going to see, we'll manage this. Your thyroid disorder looks fine. Even though you have thyroid symptoms, your thyroid panels look okay. Well, they weren't optimum, and we basically discussed with her, tell me your story. Tell me when you started to have these problems. And how we figured this out was she used to live in an area that had a lot of coal mining and a lot of manufacturing. Okay, well, and she says, that's the time where I was the most stressed. I didn't feel the best. And that's when I started to have thyroid symptoms. So you have to be a detective about this. Well, okay, if you're living around that area, why would I not want to run a heavy metals test and essentially a chemical test? We want to see what's going on. Maybe you picked up some stuff from this that never got detoxed. And she switched to a gluten-free diet. That's another thing that has arsenic in there. And you flood the system, and now the thyroid suffers. And so no amount of Synthroid or Levothyroxine is going to change this. You have to detox. Adrenal glands. So we talked about the other thing that pushes thyroid issues and immune system. What are your adrenals doing? Your adrenals are on the back, in the back here on top of your kidneys. And they're two glands that regulate a lot of things, especially electrolyte balance. They help with blood pressure. They help with the thyroid hormones, neurotransmitters. They do a lot, all right? So stress, when we talk about it, most people, when I say stress affects this, they say, well, I'm not too stressed. Well, there's many different types of stress. So this is a stress wheel that we look at. Stress is in the middle. So you can have perceived stress through here, and that's your relationships with people, maybe a lack of control of things that are happening to you. You have issues with your work, maybe you're burnt out. So that can be perceived stress, but we also have circadian disruption. Most people that say I'm not stressed will also tell me that they go to bed at a different time every single night. They don't fall asleep, they don't stay asleep. So these are all the things that can happen with circadian disruption. Caffeine consumption, we have pain. So even if you have a slight lower back pain that you always just have, it's mild, that stresses your body out. That will cause issues with thyroid and immune system. Daylight savings time, can't control that. Jet lag, shift work. Ask me how many nurses and flight attendants, those types of jobs have thyroid disorders. A lot. We have inflammatory stress, so infectious diseases, allergies. We have cardiovascular issues, just straight on arthritis and gut inflammation. And then you have your glycemic dysregulation. So this is another stress to the body. Poor diet choices, just not eating well stresses your body, okay? Stress eating too much will stress your body. So all of these things affect your adrenals. So current patients that are in here and new patients possibly that are in here, when I ask you if you're stressed, think of everything through here. Don't just think, yeah, my job's okay. I'm not stressed. My life's okay. You have to look at every aspect of stress in order for us to calm things down. So one thing we look at is stress from exercise. And I did a video on this about thyroid and exercise, because what do most people do, especially if you are a hypothyroid patient that's in their 40s, late 40s, 50s, and 60s. I go out for a long run every single day and I don't lose weight. Okay, here is why. Great study about exercise intensity and its effect on thyroid hormones. What this study tells you is that when you go for an extended cardiovascular run, maybe over 20 minutes where you're just doing this and jogging, you will actually lower your total T3, your thyroid T3, your thyroid hormone T3. It will go down every time you do that. And chances are, even after you do that, the day after. So that little jog, that 1 mile, 2 mile that you do, or you run around the block, makes things worse for your thyroid and probably will make you gain weight. Because if T3 goes down, what do we know about metabolism? It slows down. We aren't burning energy, and we're going to store fat. Okay? So that is a big time thing for thyroid. You're stressing your body out with this. Don't go for a long run. That 30-minute walk, that's okay. You can do that little 30-minute walk or the walk around the block, because you're not stressing your body out. You're just doing this little nice walk around. You're not getting into this run or this little jog, okay? So how do we test adrenals? We want to test your cortisol rhythm. That's one of the easiest ones that we do. This is one of the old test styles that we used to use, but we do use a new one. But we're checking either saliva cortisol or urinary cortisol output. Cortisol is a hormone that comes from your adrenal glands. It is released under stress. Under prolonged stress, it decreases. But what it does in your body is it helps your body regulate your energy, helps your body regulate your sleep. And it's high in the morning. You release cortisol very high in the morning to help wake you up, get energized. And then as the days goes on, it basically decreases the release. Should be at its lowest point at night, cortisol, and that helps you go to sleep. Okay, so it has to regulate. As the night goes on, it will increase again, and that keeps you into a deep sleep. Your thyroid hormones are watching this. So when your cortisol is being released in rhythm through the day, your thyroid also has to release T4 and T3 in appropriate amounts so that your cortisol, or basically your hypothalamus pituitary axis, is regulated, and that includes the thyroid in that. So all those hormones are looking at each other. So for this person, they would talk to me and say, yeah, I wake up, I'm not very energetic. At noon, I crash, and in the afternoon, I feel pretty decent. And this is where we see their cortisol. Not very high in this blue line, not very high in the morning. At noon, way lower than it should be, and they crash. Then they pick up in 4 p.m. and midnight here, and they're okay. And so that tells us where we need to start to push the cortisol and de-stress their body, because apparently around here, the adrenals are not functioning appropriately. Then maybe it's stress. Maybe that's when they work. And we have to deal with that before the thyroid can even think to work better. We have to make sure that cortisol is being released appropriately. Here we talk about your hormones. Estrogen therapy warning. Estrogen therapy warning for women with thyroid disease. Okay? So estrogen, what they're talking about in here, and what we know about women especially, what happens as women age, at 17, if you have acne and you're a woman, what do? Birth control. 25, I have painful periods. Birth control. 40, and I have fatigue and weight gain. Well, let's give you some estrogen and progesterone. 50, with low libido and depression. Estrogen, progesterone, probably along with that as well. So every time a woman complains about one of these things, they immediately think it's a lack of hormones, and they start to give you that. Well, what if you also have thyroid disorders or a thyroid disorder? This is saying that excess estrogen is going to make your thyroid worse. You don't want to do that. And as we know from when we went all the way back in the slide here, what pushes an immune system attack? Estrogen surges. So this is why a lot of women, this is not the answer. You go on estrogen, you don't feel any different. You might even feel worse. And you basically do not want to have these in combination. So here's a great test that we run. What's your estrogen doing? You have to know. The blood test that you're getting from your doctor that just says estradiol, that doesn't tell us anything. It just tells us how much estrogen is floating around in your bloodstream. But you have 2 other estrogens. You have your E1 and your E3. And so we have them right here. We have estrone and estriol. And then in the middle, you do have estradiol. But what about the 2 other ones? You have to make sure they're within normal limits. And then your body also has to use the estrogen and get rid of it. And this is where the majority of my thyroid patients have problems. And it will never be tested by your doctor. You have to see this via a urine test. You have 4 metabolites of your estrogens right through here. 16-hydroxy, 4-hydroxy, 2-hydroxy, and 2-methoxy right here. This is your detox pathways. And this is where actually your liver comes in again. So if your liver is not getting rid of your estrogens, guess what's going to happen? Estrogen surge, your thyroid goes slower. And number 2, excess estrogen in women, we may have some weight gain around the midsection and the hips. And that may also cause the thyroid, again, like we talked about, to keep that weight where it is and never let it budge. You would be shocked how many patients we have, or how many patients or docs that I know that utilize this. Once they figure out that you have problems detoxing, if you start to work on some of these pathways, the weight starts to come off because there's no excess estrogen making the thyroid slow down. If you can pull through that estrogen, that thyroid can speed back up. And so like we said, that's one of the reasons you have hypothyroidism, is there's an estrogen problem. And especially with Hashimoto's disease, this pushes it big time. So with this patient, as you can see, if you can see, we have these little dials here with arrows, and we're looking at these three. These are your three primary estrogen metabolites right here. This one is the one that you need to make the most of because it's the most protective and it doesn't do anything to your body. But as we can see with this arrow, we're way low. This one's normal and this one's high. So you're sending, or this person specifically is sending all the estrogen this way and it's getting stuck. So now her E2 and E3 here, as you can see, they're red, very high estrogen. She can't lose weight. She has hypothyroidism. And all we now have to do is push her estrogen down this pathway. And you can use certain supplements. You can use food to do this. You have a molecule called I3C, and that's something that's in broccoli, asparagus, Brussels sprouts, those types of things that actually help your body push estrogen through and get rid of it. And so when we talk about eat more broccoli, it actually works. But you have to be careful because if you have Hashimoto's, that might not be the best thing. So we'll talk about that here in a second. Other tests that we look for on this will be B12, B6, glutathione, because they push those pathways. And then here's your neurotransmitters as a thyroid patient. This comes into play with the mood disorders, the depression, the anxiety, the brain fog, the irritability, the anger. I mean, you name it. Anything that goes along with the cognitive issues or memory, those types of things, your neurotransmitters have to be looked at. So let's say you're a thyroid patient and we know you're on levothyroxine. Everything else is working fine, liver, all those different things, but we run your neurotransmitters. And like this person, we have norepinephrine and epinephrine above range, and we have serotonin above range. So remember all the way back in the very beginning of this talk, that thyroid or low thyroid states inhibit this response. So you start to crank out norepinephrine and epinephrine. And that's basically like adrenaline. And so your adrenal glands essentially working overtime. When you have that high norepinephrine and epinephrine, this woman or this man will be irritable, have major anxiety or just anxiety, not able to sleep, feel like they're wound up all the time, and they just don't feel good, even if everything else is fine and their thyroid panel looks okay. So what we know about this then is that this pathway is not working because of the thyroid. So you support this pathway. You can support it with things like theanine, magnesium, selenium. Those types of things will actually help this pathway work. And now we have a person that is, everything else is regulated and they finally don't feel anxious. They feel calm. They have good energy now. They have a great mood. Their spouse doesn't want to kill them. All these things will start to happen, and it's that little tweak. And as you notice, I never come back to Synthroid levothyroxine. It's not, oh, she's anxious, let's raise her dosage. It's she's anxious because she has a thyroid problem because of norepinephrine, epinephrine. Okay, so there's all these little details. 54% of patients with Hashimoto's and hypothyroidism have gut problems. Over half, guys. So this, and if you know me or if you follow our stuff, I talk about the gut so much. And you don't have to have gut symptoms to have gut problems. You don't have to have gas, bloating, bowel movement issues to have issues with your gut. So we obviously know diseases like IBS, celiac, IBD, diverticulitis. We know the big guys, but you can still just have issues with bacteria, yeast, any other organism in your gut that has to be cleared out. So when we're talking about intestinal dysbiosis, which is kind of cut off here, 54% of you guys that have hypothyroidism or Hashimoto's have this. So you've got to test for it. We look at the effects of stress on gastric ulceration, T3, 4, reverse T3 and cortisol, and neonatal fouls, hormone regulation of murine T cells, potent tissue-specific immunosuppressive effects of thyroxine targeted to gut T cells. A lot of information. Basically, these are two big studies looking at gut ulcers and then also the immune system response in the gut and how it regulates your thyroid hormone. What they found is if those two things are occurring, thyroid hormone secretion, absorption, all those things goes down. It slows. So the gut is important. And like we know from the very beginning, where is a lot of your T4 converting into your T3? The gut. If there's bacteria in there that's not supposed to be in there, or if there's candida, yeast, you're not converting your T4 to your T3 again. So let's take a look. You got to look and test. Here's one of our stool tests that we use, a very baseline one. We have others that we can use in different situations. But we want to see your good green, your yellow cautious, and your red infectious bacteria, if there are any. For this person, we have a whole bunch in the yellow and the red panel. Down here, we would look at your yeast. So when you're talking about the gut, you've got to clear these bacteria out, because if you don't clear them out, or if you have parasites, those things will cause inflammation. They cause stress to your body. And as we know, what causes immune system attacks? Those two things. So your body, if it has these little bacteria in there, is constantly mounting an immune response. And that means those Hashimoto's antibodies are floating out all the time, eating away at that thyroid. If you can clear these out, then the thyroid hormone can convert. You start to feel better. Food sensitivities are another thing we want to look at, because if we have leaky gut, and if you have foods leaking through, or food particles leaking through into the bloodstream and mounting an immune system attack, every time you eat, for this person, a banana, your body is stressed. You will have an immune system response, and then you will have a thyroid issue as far as slowing down. So sometimes when we've had a patient like this, where literally the only thing we had to do to help them out to get their thyroid to work better was to get their diet straightened out according to their food sensitivity test. Because think about it, if your body is releasing antibodies that stop conversion, and it's driven by an immune response, and you eat foods that cause immune response, that banana is essentially causing you to attack your thyroid. So if you remove that banana from your diet, and that's not forever, you remove it for a little bit, work on the gut, help the gut seal back up, you can introduce that banana again. But if you remove that banana, and also we got pineapple here, if you remove those, your body is not going to push that immune response anymore. So then the antibodies for Hashimoto's start to go down. Your body can speed back up, or your thyroid specifically, and the thyroid symptoms go away. So let's wrap this up as far as how functional medicine compared to your conventional helps this out, because we've touched on many different things. Liver function, we've touched on toxicity, we've touched on stress, adrenals, we've touched on the gut function, the food sensitivities, all these different things that we've looked at. How do you take a patient, or how do we take a patient and fix all of those things to get the thyroid functioning better, get you feeling better, helping you lose weight, thinking better, feeling happier as compared to Synthroid? So when we look at health, health is on a spectrum, all right? When you're living your life, you don't just all of a sudden have a heart attack. You've been developing that heart attack for years, and it finally happens. And all along the way, developing that heart attack, maybe you're a smoker, maybe you didn't exercise, maybe you eat terribly, maybe you have a stressful job. All of those things lead up to that heart attack, okay? A perfectly normal heart doesn't just fail in the majority of cases. So on your health spectrum here, maybe for thyroid, we have a thyroid patient here. Maybe at one point, Susie Johnson was healthy. But Susie Johnson, as she got a job and different things like that, maybe she started to have a poor diet because she didn't pack her lunch, and she just ate from the, chip machine, and she drank her Cokes and all those things like that. And she was sedentary because she's working 11 hours a day, no time for exercise. She gets home, she gets tired, and obviously the job is stressful. So that's the first step off of the spectrum, or her health spectrum, for Susie Johnson. Now, if Susie Johnson doesn't do anything about that, she doesn't clean up her diet, she doesn't get any exercise, and she doesn't help deal with the stress, the next thing that occurs in Susie Johnson's life is now she's inflamed, okay, because she doesn't have nutrients. She has gut issues because all that crappy food that she's eating is not actually creating good bacteria. She's constipated, and she's fatigued. She doesn't have enough energy because she's literally not exercising and not giving her body vitamins, nutrients, minerals, all those things. Well, she says, well, that's just a normal part of life. I'm just getting older, and I hear that all the time. Well, Susie Johnson, again, doesn't do anything. So now Susie Johnson has hormone issues. Maybe she's getting up in age. She's 55, 60 now. She has a mood change. She's irritable. She's a grumpy old woman now. She has sleep problems. She can't fall asleep. She can't stay asleep. And what does Susie Johnson say? Well, that's just me getting older. I'm just old. I always, my mom went through this. My grandmother went through this. I have a sister, same thing. She can never fall asleep. She doesn't sleep either. It's just what our family is like. but never addressing these things, she continues along. So then Susie Johnson starts to have weight gain, cold hands, cold feet. She starts to have issues with anxiety. Now she's anxious. She snaps at her husband. And she has no sex drive. She doesn't want to do anything. And she's just sedentary even more so than she ever was. At this point, Susie Johnson gets upset and she says, you know what? I'm going to go to my doctor and I'm going to ask him if there's anything he can give me to make me feel better, because I'm tired of living like this. It's been 10 years living like this. I don't know what to do. So go to the doctor, and the doctor says, hey, we found out that you have a high TSH. You have a thyroid problem. Susie Johnson, I want you to take Synthroid. How long do we take Synthroid? Forever. All right. So now Susie Johnson says, awesome. I finally figured this out. My whole life, I've been feeling like crap, or at least the last 20 years, ever since I started working at this job. And I finally figured out it's been my thyroid this whole time. So now I'm on Synthroid. Everything should be fixed. And guess what we know about Synthroid and hypothyroidism? It's not fixed. All right. She continues to feel like this. She's stuck over here. So Susie Johnson comes to me and says, I've been on Synthroid for 5 years. They keep increasing my dose. I have no idea what to do. I still have all the symptoms. I asked my doctor what to do. He sent me to a specialist. I asked the endocrinologist what to do. And he said, well, your Synthroid dosage looks fine. I don't know what's wrong with you. We'll just keep watching it. And so now I'm coming to you. I heard functional medicine can fix people. I saw your testimonials. What can you do? So for me, now I get a hold of Susie Johnson, and I'm looking at her labs, and all she has is a TSH and T4. That doesn't tell us anything. But I know her symptoms. So let's start running labs based off her symptoms. So we've got no sex drive, anxiety, all these different things. Let's take a look at some lab tests at her thyroid. They're actually, a full panel. We have to get a full panel of her thyroid. She has a normal TSH. We know that because she's on Synthroid. But her T3 is a little bit low. It's suboptimal. It's not where it should be. We also have a high reverse T3. That means she's inflamed, which, as we know, on all the way down here, there's gut inflammation happening. So we have a high reverse T3. She's positive for Hashimoto's. That means she has an immune system issue now, not just her thyroid. And she has poor adrenal and hormone function. So we ran an adrenal test because of her anxiety and her sex drive. And now we know that there's estrogen issues and possible issues with her adrenals. Well, we don't know about all the rest of this, so let's keep running some tests and see what's up. So the gut issues, because I knew about her reverse T3 being high, now we know we have to check her gut. Because what's going on in her gut that's making her reverse T3 so high? So we look at this and we say, okay, how often is she having a bowel movement? Every 2 days. That's constipation. I bet she probably has some dysbiosis, because we know that more than half of people with thyroid disorders have dysbiosis. So sure enough, she has a couple infections here, yeast and a bacterial infection. She has low immune system response in her gut. We have a B12 deficiency that we found out. And we have a poor detoxification issue or function with 2OH. So that's why the estrogen issues are now coming into play. Finally, I want to look at your diet. We say, okay, Susie Johnson, we know you have gut issues. We know that you have adrenal issues now and hormone issues. And we know that your T3, even being on Synthroid, is not exactly where it should be. The last thing I want to see is, how are you eating? And Susie Johnson says, I eat like a normal person. Well, a normal person, especially in the United States, doesn't exactly eat well. So we've got to figure out what type of diet is she on? How do we change it? So sedentary diet, she has food sensitivities that she never knew she had, and that's probably because she has an immune system issue or autoimmune disease like Hashimoto's. She has a high carbohydrate diet. She's eating tons of carbs, and that's feeding her yeast. Yeast or candida feed off of carbohydrates. So now we have this high carbohydrate diet causing a candida infection, which is causing inflammation, which is causing a high reverse T3, which is lowering her actual T3, which now makes her adrenals not function very well, and her estrogen is not being detoxified. Boom, boom, boom. We just figured out the entire story of Susie Johnson's life based on just a few lab tests. And it has nothing to do, as we know, did I mention thyroid once as the main root cause of her problems? No. Her root cause was starting out having a poor diet, having stress, and doing nothing about it. So now we have all this. She has a genetic history of autoimmune. She told me her mom and a couple other relatives have things like rheumatoid arthritis. So what do I do? Okay, so let's start to fix these problems so we fix the thyroid problem. The first thing we're going to do is we're going to take that food sensitivity test and we're going to look at it and take out all the foods that we know trigger her immune system response. We're also going to tailor the way that she should eat to her specific problem, meaning thyroid. All right, we're going to talk about that here in a second. We have antimicrobials, antifungals to clear away the candida. We don't need antibiotics for this because remember, what will antibiotics do? They will cause our thyroid absorption to go down. So we can use things that are natural that kill off candida, kill off bacteria. We're going to use DIM. That's something that burns off estrogen down that specific pathway we're talking about. And just some sublingual B12 because we found out she has a B12 deficiency. B12 helps many things. Detoxifies your liver, breaks down your cholesterol, breaks down your estrogens. It pulls those things out of your body, helps neurotransmitter function. I mean, it does a lot of things. So if you're deficient in that, the thyroid can't do its job. So we just give her some sublingual B12, high dose. And then for her estrogen issues, mood change, irritability, we're trying to figure out this Hashimoto's. So now we give her some immune system regulators, something that'll help balance that immune system out, even though we're working on it through here by clearing up the gut and clearing up her detox issues. We want to make sure that we support her immune system in a good way. Maybe we give her that high dose selenium, high dose zinc, because those lower antibody levels. And while we're working on everything, we can help her feel better along the way. So we do these things, and it literally takes, for Susie Johnson's case, 5 months. All right? This is not Synthroid for the rest of your life. And hey, sorry, good luck. I hope it works. And if you have symptoms, it just is what it is. This is a short period of time to clear things out, teach you how to eat appropriately to what you have going on, and then you just manage it yourself. As long as you keep those thyroid antibodies down by keeping everything else through here clear, your Hashimoto's never flares up, your thyroid never slows down, and you will feel phenomenal. Turn off my phone here. So that's what we have to do. And this is functional medicine. That's what the name functional medicine means. Break down in function. You have to fix the function in your body. You don't just replace thyroid hormone because of all this crap that's going on. That's the biggest difference between this and conventional medicine. How on earth is your doctor going to look at all these symptoms knowing for damn sure that it's not just your thyroid and look at you straight in your eyes and say, I'm going to give you one pill in the morning that's going to fix all this? It's just never going to work. So you've got to clear all this stuff out in order for you to have any chance at getting this Hashimoto's to calm down, have your thyroid working better, okay? So as a generalized help, because I know a lot of people get on these Zoom webinars and they want to know, okay, I have thyroid disorders. Is there anything I can do in the meantime to help myself? So the next 2 slides, I put up what you must do. But again, this is generalized information. This is not to treat your specific thyroid disorder. This is just what is going to maybe help alleviate some symptoms, certainly not fix everything like we showed in the other slide, okay? So the first thing, general supplemental aid. Omega fatty acids, 4 grams of omegas, and that is not fish oil. This is the omegas in fish oil, okay? Because you're going to go to your store and you're going to look at fish oil and it's going to say 1,000 milligrams of fish oil. And you're going to go, that's great. But the problem is inside that, if you flip it around on the back, it's going to say 1,000 milligram capsule, 300 milligrams of which are omegas. You must get 4 grams of omegas daily for immune regulation and insulin sensitivity, all right? Next thing, probiotics. This one's tough. You can get a generalized probiotic, but I would always tell people base it off your stool analysis because you want to make sure you're filling up the right strains and not strains you already have that are high. Digestive enzymes break down proteins and decrease inflammation. So you want to take these before your meal. They help break down your food, break down proteins. You have selenium, 200 micrograms per day on an empty stomach with vitamin E. That helps lower TPO antibodies. Selenium also helps you convert T4 to T3. Zinc, max dose, 30 milligrams daily. I just posted a video on copper and zinc yesterday. You don't want to throw off that ratio. That can cause neurological problems and brain problems. So max this out at 30, helps thyroid antibodies. And then vitamin D, dose based off of lab work, because that's going to give you the best shot of raising your vitamin D. But I always tell people 4,000 IUs a day is a pretty easy and low toxicity type of dosage. So make sure you get that 4,000 IUs. If you're messing around with 1 or 2, it's probably not doing anything, okay? What you must do generally for exercise for the thyroid: no long runs or jogs. This is not even my opinion. As we've shown, this is research-based. You must not do that. So what you should do is yes to high-intensity interval training. And this is the easiest thing you can do for high-intensity interval training is 8 minutes. Go outside, and what I want you to do is run as fast as you can for 15 seconds, and then walk for 45 seconds. Repeat that process for 8 minutes, and you will have a much better exercise as far as productivity in 8 minutes compared to your 45-minute jog. You will burn more calories. You will burn calories 3 hours after you're done exercising. And the best part is you don't lower your T3. Your thyroid will actually be happier that you do this instead of doing a long run. And it's only 8 minutes. It's easy. We want to walk 30 minutes a day as well. Yoga for stress reduction, that helps out great, helps tone the body. General diet advice: follow an autoimmune diet first if you test positive for Hashimoto's. Taking things out that are like dairy, grain products, and sugar are the big 3. Take those out for a few weeks, see how you feel. That will help you feel a little bit better. It should. Avoid high amounts of goitrogens. So this is where I said it kind of gets tricky, and that's why if you really want to get this solved, work with a practitioner like me. Cruciferous vegetables, spinach, sweet potatoes, etc. Google the word goitrogen. You'll see a list of foods. You want to avoid those because those will cause problems possibly with the thyroid, possibly with estrogen. Don't do a low carbohydrate diet, okay? I know we talked about high carbohydrate diet being a problem, but also low carbohydrate diets can be a problem as well. If you're doing a low carb diet, we've also seen in research that will lower your thyroid hormone as well. And I know a lot of people try to go keto on this. I probably wouldn't. I would actually have some carbohydrates in there, fruit, those types of things, good sugars, keep up a little bit, maybe 60, 70 grams a day, right in that sweet spot, all right, so that you don't get into ketosis. But we've shown plenty of times where that low carbohydrate diet, Atkins, those types of things, long-term just doesn't work for this. It lowers the thyroid hormone. Customized to your diagnostic testing, which would be the food sensitivities. This is such a, even if you don't have thyroid disorders, you're just in this talk just looking for information, food sensitivity testing is crucial. I mean, there's plenty of people that I've had that have 0 issues, and we test for food sensitivities, and they have all kinds of food sensitivities that you need to take out of your diet. So that's something, especially if you have Hashimoto's, because those foods will push this immune response. Gut test. I always tell people to get a gut test. Doesn't matter what disease you have. See what your gut looks like, because it is the easiest place in the body to get messed up, especially if you've ever taken antibiotics, oral contraceptives, poor diet, non-organic diet, anything chemically based. I mean, your gut gets wrecked very easily. You have to have a healthy gut for everything. And when you work your gut over and get it healthy, a lot of diseases start to go away. Okay. We've got a little video. So this is somebody that is a former patient of ours. Hopefully this has sound. If it doesn't have sound, we'll just skip over this. But this is the person that had the arsenic issues that we were talking about. And I kind of want you guys to just listen to her story a little bit. And as far as transformation through just for 3 months with us when we worked with her.
Center in the Carolinas, and I read his website, I read some of his articles, and I was really intrigued by some of the testimonials of the people that he had helped. And so I scheduled my free consultation, and I came to see him. Some of the symptoms I've been having were hair loss. I had gained weight that I couldn't get to budge. I was feeling, I had high heart rate, and I was dizzy often. I felt low blood sugar. Often I would get stuck if I was out somewhere with my family, like one day we were whitewater rafting and low blood sugar hit me and I almost passed out with my small children. I just knew something wasn't quite right. Earlier I'd been diagnosed with 49 food allergies. And so I was trying to avoid those 49 foods, and I was still sick even when I was eating stuff that wasn't on my food allergy list. I really couldn't get to the bottom of it myself or with the help of other doctors. So in May, I came to see Dr. Reiser, and I presented him my lab work for the last 10 years that I had collected over the years from other physicians. And in the free consult, he looked through my lab work, and he basically read my labs to me and said, "You're experiencing this. This says this. This is why you're feeling this way. You're probably also feeling this way." And when he was able to explain to me what I was feeling better than I could explain it to someone else, I knew that he was going to be the one that could help me. And so at that point, I decided to work with Dr. Reiser on this program. And the first thing we did, we started out and did all new lab work. And he was very intuitive when he asked me where I grew up in West Virginia near the coal mines. And because of that, he decided to do a heavy metal toxicity test and found that I had arsenic poisoning at extremely toxic levels. I believe the range is like 2 to 12 is toxic. Mine was 56. And it was causing my adrenals to crash and, various other health issues related to my hormones and my thyroid and kidneys and all of the things. But when I went through the program with Dr. Reiser, and I'm only 3 months in, but we've made significant progress. We were just today looking at a photo of me back in May prior to starting the program compared to now, and I've lost about 18 pounds. The inflammation and swelling in my face is a noticeable difference from the photo back in May, and I'm feeling more focused, more energetic, and feeling like I'm on the right track. One of the very first things that we did is we changed my nutritional lifestyle. I feel lighter, I feel less brain fog, and I feel more focused because I'm not constantly fighting that inflammation in my body. So I would recommend that anybody watching this, that if you are having issues with blood sugar or autoimmune issues, food allergies, unexplainable issues with constipation, or general health issues that you've tried to solve on your own, I try to solve them on my own, and I can only get so far. When I started working with Dr. Reiser, that's when I had someone to guide me based on the data. That's when I first had someone to say, yes, do this, no, don't do that. We're focusing on the wrong thing here. Let's refocus here. And I feel like I've made significant progress in the last 3 months. So I would highly recommend that you make the investment into yourself and into your life and your lifestyle, and work with someone who is going to truly investigate your specific customized issues and help you fix those.
All right, so great example there of somebody an issue that you would never think to even look at, and like we discussed with the heavy metal test, you say that to your doctor and they'd say, "Oh, I don't think that's your problem." So you come back to really the reality of the situation is these tests exist for a reason, because these things happen to people, they happen to you, they happen to me. And if they're available, why not test them if there's a good reason to look at that? And for her, there was a good reason. She spent 10 years trying to track down the real reason she had thyroid and blood sugar problems and all these things, all the while just staying with medications and getting no answers from conventional doctors because they're going off your insurance. An insurance test is never going to be, or an insurance is never going to cover that heavy metal test. So you've got to sit there and say, okay, you know what? I need to start to feel better. I need to figure this out. And just based on her telling me where she was from and when she started to feel bad, it was, we have to do a heavy metals test, because your thyroid, as we know from clinical research, slows down when you have heavy metal toxicity, and boom, there it is. The piece to the puzzle that's been missing for 10 years for her, for 10 years. In just 3 months, totally different woman, totally different. So that's what this entire presentation is about, is here's the things that you need to know about your thyroid. And in many cases, it's not your thyroid. 9 out of 10 cases, it's not your thyroid. And there's many things that affect your thyroid, and simply just replacing your hormone is not going to fix the problems. And as we know, levothyroxine is usually the #1 most prescribed medication in America every single year. Why is that? Why are we having more thyroid problems? And I think it's because we stopped looking at the things that cause thyroid issues, and we've just began to monitor and manage people and just run you in, run you out every single year, every single 6 months you come in. If you guys want more information like this, there's a great podcast I did with the Primal Blueprint. It's with Mark Sisson and with L. Russ, episode number 400. So that's easy to find. Just go to Primal Blueprint Podcast, Google that, or .com. Look up episode 400. We do about an hour talking about thyroid, diabetes, functional medicine, period. So that's something that you can listen to, get a better idea of my mindset when it comes to a lot of these disease processes. And if you're interested, because this is a thyroid-specific talk, we have this thyroid panel with Hashimoto's testing, okay? So because you watch this, we do have your guys' emails and things like that. But if you want to see a full thyroid panel, looking at reverse T3, T3 uptake, testing for Hashimoto's disease, seeing if you have it, you can do that. By doing this webinar with me, you're already now considered a patient. So you can actually go through and get lab work with me. And what I'm doing, obviously, right now is a tough time. The lab work that we're going to do, the cost is there, but I'm going to include the consultation with it so you can get analysis and then also kind of get a breakdown of where you should go from there if we feel like treatment is something that can be done with you. If we know what direction, I always tell people I don't want to take you on as a patient unless I know the clinical picture, unless I know exactly what direction we need to go with you. So if you'd like, you can either email info@fhccarolinas.com, info@fhccarolinas.com. Give us your first and last name, contact phone number, mention the Thyroid Zoom webinar, and then it is $115 for that entire thyroid lab panel and the consultation with me. Before anybody asks, no, your doctor will not do this probably. And no, I can't give you a lab requisition so that your insurance will cover it. The problem with it is if we try to send it to your insurance, they may look at this and say, well, it's not time to run it. That's not your primary care physician. And they may charge you $400, $500. So this is a professional co-op cash wholesale price for this. It runs everything. It will tell you if you have Hashimoto's, and it will tell us T3, free T3, and all those. So you have a good idea of what exactly is happening with your thyroid. Also, if you're somebody that doesn't know if you have thyroid disorder, you can look at this and we can be able to tell you, yeah, maybe you do have hypothyroidism, or maybe you have Hashimoto's, and you can start to feel better. So those are your options. If not, we're probably going to email everybody beginning of the week that has been in this Zoom webinar, see if you're interested with that. Because of COVID-19 right now, we are probably going to do virtual stuff half and half, but we're doing, as far as the office is concerned, we are still open. We just take precaution. We're cleaning in between every single patient, desanitizing, keeping 6 feet from everybody pretty much, and you can feel comfortable coming in here and we can still have a consultation face-to-face, okay? So hopefully you guys got a lot of information today. If you have any questions, you can email me directly as well, dr.riser@fhccarolinas.com. So dr.riser@fhccarolinas.com. Email me, ask me anything specific to your case. And like I said, if you'd like to do this, we will either email you or you can email us at info@fhccarolinas.com. Stay safe, everybody. Hopefully that we'll see at some restaurants here in a couple weeks when those things open back up. And have a great week and great weekend.